welcome to Weekly Infusion with Dr. Drew Pinsky and Dr. Bruce Heischober. Weekly Infusion addresses medically related topics. It's in the know, entertaining, and everything you want to know about health and medicine. Now may I present to you the very wonderful Dr. Drew and Dr. Bruce.
Hey everybody, welcome to another Weekly Infusion. It is just myself. Dr. Bruce is presently in Scandinavia, exploring his roots. But instead, I brought in my friend, Dr. Paul Nassif. Paul, welcome.
Well, nice to talk to you, my good friend, for many, many years.
Many years. We'll get into all that. Paul is a facial plastic and reconstructive surgeon. You know him from, of course, the TV show Botched. And I guess you originally on TV from the Beverly Hills Housewives, right?
Oh, yes.
I'm sorry.
You had to mention that.
I'm just saying if people remember that. You are known for a revision and ethnic rhinoplasty specialist. What is that?
But I also do very good facelifts, by the way.
Well, you do. Now, let's get into that, because I've always felt like people trained in ear, nose, and throat, facial surgeons per se, make the best facial plastics. Am I off base with that, or would even your partner Terry Dubrow agree with that?
I'm going to say yes, because that's my background is ENT, even though I haven't done any ENT since I finished my residency. But then the fellowship in facial plastic surgery. So yeah, since we know the anatomy of the face and neck very well,
right?
I think it makes sense.
And to me, my exposure to that anatomy is essentially gross anatomy in medical school. And I remember being fascinated by it, and one of the reasons I was fascinated was it is so terrifically complex, and particularly the neural and blood supply issues people don't understand. These are spectacularly complex anatomies. So I don't know. Maybe you want to comment about that or talk about how you have to improvise around idiosyncratic anatomy.
I'll tell you, that's, back in the residency doing that was probably the most coolest anatomy that you can see in a very small area.
Yeah.
Also, you're dealing with life or death right there because you're, by the big blood vessels.
And the brain.
That go right there.
Yeah.
But I'll tell you, but now when we do facelifts, especially depending on the type of facelift you do, since I do something called the deep plane facelift, we're navigating around the facial nerve and looking at the branches, and again, as you know, those are the nerves that control all the movements of the face.
Yeah.
And it's challenging, but it's exciting and fun at the same time.
Yeah, it's very cool. And is there a new procedure or anything sort of you're excited about in terms of on the landscape of facial and facelift? Say facelift.
Right now what we're doing is we're trying to really do more vertical lifts with smaller incisions. When I mean vertical, as we age, we lose fat in the face, and things just start to droop, southwards. And so rather than pulling anything sideways and you can actually get, that pulled look or just not look good, we try now to lift everything upwards where it used to be. Then at the same point, besides just lifting tissue, we're trying to revolumize with adding a little bit of fat simultaneously. And that is the big cool thing that I love doing.
I've never understood how the fat is it fat or stem cells, and how does it stay there? That's what I understand. Why doesn't it just dissipate?
Well, a lot of it does, and again, depending on how you after you take the fat out, and again, number one, it depends on how you remove the fat from an area because there is a lot of stem cells in the fat.
Yeah.
But you're not really getting out stem cells. You're getting actually out the fat cells, the adipocytes. So how you take them out, you don't want to damage them. Number one. Two, you have to clean them. And there's different ways to do it, and you're centrifuging it or something, and the same way you do that has to be very careful. And then when you inject it, it has to be, let's use the word atraumatic, and with the best care of that, and then adding some platelet-rich plasma, PRP, which is, product of your own blood that has all the growth factors in it, you have those transplanted cells.
Okay.
You get maybe about 50% of fat survival.
So it's really
is a good number.
It's the what we call the mediators, the anti-inflammatory mediators, the growth factor mediators that the platelets put out that are probably really why you get these good results now. That makes perfect sense to me.
Yeah, and I've been using platelet gel for good 18, 19 years now.
And what is that now? Is that injectable platelet gel? Or
yeah. Remember, you draw a little bit of blood from the patient before the procedure, spin it down, then you get the little platelet plug, and it's the yellow without the red blood cells, and without the white blood cells. And then you take that and you inject it in the area. And, remember, we can't, at this point in plastic surgery, at least in this country, for cosmetic use, there really is no good way yet to use stem cells because, the whole FDA, the way they approve how you break down the tissue, chemically or ultrasound, it just hasn't gotten there yet for the FDA to let us do that. But eventually, we'll be just injecting stem cells.
Now, aren't they doing stem cell injections into the breast? Is that happening now, or is that just what you're talking about specifically for face, or both?
Well, I don't, quite honestly, in regards to getting the real stem cells, I know some people do have the machines that can break down, let's say, the fat. Either you get it from bone marrow, so you can get it from bone marrow, but the biggest thing is, especially belly fat. But to break it down, I don't, if doctors are saying they're actually injecting straight stem cells, I don't know how they're really getting it because I know the FDA really hasn't, unless I'm misinformed.
Well, no, that makes sense. That made sense to me because I never understood how they could make that claim. I wondered the same thing. So that's why I was wondering if you were talking about something that was just about the face and there was something else going on in other parts of the body. Okay, that makes perfect sense to me. And how do you decide what procedure to do? Susan, you want to be a guinea pig here? She keeps talking about wanting to have plastics and this and that. And I keep telling her, come on now. Come on, you look great. But how do you decide if somebody gets an eyelid versus a forehead versus a chin? And Susan's on the
neck.
Susan's on the line.
Neck. Wait! I'm trying to do Facebook Live, so you just tell me what you think I need, Paul. You've seen my face.
Yeah. Okay. Wait. You're putting me on the spot here.
Go ahead.
Listen. Okay, I'm 58 years old. Okay, so
Susan
it's okay.
has no problem objectifying her face and body. She has zero problem with that. She's a very, strictly speaking, a pragmatist when it comes to all this. So go ahead.
So like you've talked to me. Let's just talk about the neck for a second. And as we age, the platysma muscle, which controls movement of the lower lip, it plus other muscles, but it extends from the bottom of your mouth all the way down to your clavicle. Just above your chest bone there. And that muscle has so much use in it, you start getting these little bands in the middle of your neck. And then you start getting some loose skin. Again, that's the bottom of where all the gravity hits.
Yeah, I have that.
I also
Drew has a lot of that.
How dare you? I said you like to be objectified, not me.
Here we go.
But not only that,
I'm not a narcissist. It's okay.
Not only that, I have poikiloderma on my skin too, which is really what messes it up.
Ooh, what is that? Poikiloderma.
Sun damage.
So it's all the little red spots.
Yeah.
I wouldn't
so that
know
means
that word.
if you look at his neck sideways or the wrong way, it turns red.
Yeah. And it has what you think of as sun damage. So.
But again, and actually, if you do a little lift on you, just by lifting up the skin, that's going to get a little worse even. So you have to treat that.
Oh, really? The poikiloderma?
Yeah. You can treat that with the gentle laser. The problem is with the neck, you have to be careful because the healing glands of the neck aren't great. The sebaceous glands, which are in your face, which that's why the face heals well, like even after a scar or something or laceration. Yeah. But the neck, you have to be very careful.
Can you just use Retin-A or topicals on there?
Yeah. For example, the best thing, for example, I know we'll probably mention later, but my Nassif MD BioClock line, I have a DEC neck serum on that.
Well, I could be case A. Let's do this.
But the point is, you have the redness, though. The redness is, I'm talking about for wrinkles.
Is the redness
is not going to work with that.
It's not very noticeable. It's just, is it very noticeable?
But with the lines that get there, that my before and after is just for my neck, DEC, and the red spots. Actually, you know what? I have to tell you I'm wrong. With you, because some of the before and afters I have a lot of sun damage on the DEC.
Yeah.
Same kind of thing with the neck. Mm-hmm. This actually might help with that. So you might be our test zero, our first patient.
Also, he needs Botox in his neck to get rid of those
the lines you were talking about. Yeah.
The ones, tight, it looks like you have like a line going down.
I've
had
muscles.
that done.
Yeah,
it's great.
Yeah, you can do that. But the thing is, so from the surgical aspect, remember, you can tighten those muscles from the midline by making a little incision there, and going down and putting those little muscles together called a platysmal plasty. But again, it's the whole evaluation. If you have excess skin and you're a little bit older, you got to also make that little incision around the back of the ear, maybe a little bit in front of the ear, and lift, go underneath there, pull the muscle that way also from the side, and tighten it from the midline. And then remove a little of that excess skin from around, you pull that excess skin that was hanging, and you kind of recruit it up to the ear, and you remove it.
I had a patient once have some sort of, they implanted something in the chin to string it up, and it drove him nuts how it felt. He hated how it felt. Do you remember that procedure?
Are you talking about string? Are you talking about those the different types of long sutures or strings they put in the neck?
He told me that
thread lift.
I think he said there was something under the chin, like a plastic device under there. This was a long time ago, and it was just very uncomfortable. So I'm glad to hear those aren't being done anymore.
Well, now you're talking about under the chin, you're talking about for the chin, a chin implant. Is that what we're talking about?
No, he had it for the neck, and he was very troubled that his neck didn't look youthful, and he wanted it. He's a guy about my age, and he had it really aggressively done. I remember that he wanted like it not to come back, kind of thing. And he said maybe I got it wrong, or maybe he got it wrong, but he said they put something to sort of under the chin. Yeah.
Well, that could bother you because that tissue is so thin there.
Yeah.
Putting anything foreign in that area could be really a nuisance.
Yeah.
So what about the eyes?
So we'll go to the eyes now.
I had a Bell's palsy when I was pregnant, and one side of my face is a little bit more lax than the other. So when I get Botox, half my face goes in one direction. So I can't do Botox, which is the best invention on the earth by far. But because I can't do that, my eyes are a little droopy on one side, and I don't know. What do you do with the eyes?
Or do you just do the lids?
Or the lids?
Well, I got to tell you, the more, it's interesting. If I look at someone and they have, hooding where the, that on the corners of the eyes, out towards the ear, if that tissue from the eyebrow is falling, I love doing a small little temporal lift, where I make a little incision in the temple hair, lift up the corner of the eyebrow, lift that up, and then, if needed, take a little bit of skin off the upper eyelids. So I like doing the combo and keeping the patient looking natural and just refreshed, rejuvenated.
Right.
And do you put like titanium tacks up in the skull somewhere to keep things? How do you do that? What do you tie up there?
No, you put. I put little stitches that dissolve in about 6 months, because what happens is after you lift up everything to the new position, you need 6 to 8 weeks for your body to, form a little scar there, and you keep it there.
Yeah,
and that's all you need.
I went to this guy once, and he wanted to give me a brow lift, and he said he was going to put screws in my forehead, and I was like, no, can't do that.
Yeah.
I just can't handle that. And then I went to another. I actually signed up for a brow lift once. I don't know why. When I was like 45 or something, and I couldn't go through with it because they were going to, I don't know, it just was too scary.
How do you decide if you actually need surgery versus injectables? How's that decision?
Well, as you know, everyone's going to the non-invasive way.
Yeah.
And so I got to tell you, again, on the evaluation, for example, we can put filler. I mean, you try it. So in other words, you look at the patient, and if it's not that bad, you can do a little bit of Botox to elevate the eyebrow, for example. You can put filler in the eyebrow. You can put filler underneath the lower eyelids when you're hollow. So you can do a lot with filler and Botox.
Yeah.
At the same point, if you want a little tightening that's non-invasive, we have like a radio frequency machine called ThermiSmooth, which you can apply on the skin. Maybe you do 3 or 4 treatments every 3-4 weeks apart. And just with that alone, you can do that to the upper eyelids, to the cheeks, to the neck, different parts of the body, and tighten things up. It's not surgery, but it's a start.
You know what? I've had all those things. I've done all those things. I had Botox, though, one time, and I looked like a scared clown when I smiled. So I just was like, okay, this is no good. You have to have somebody who's really good at it. And then I've had the injectables in the eyebrows, and I think one of them kind of floated down. So then they have to put the hyaluronic acid in there and try to lessen the blow. I mean, I had more bags under my eyes from doing that. It was terrible. I mean,
it's technique, Susan. You can have still someone good do it and not have those problems.
I had a moment of weakness, and I went to a lady in Pasadena. I know. I shouldn't have done that. But
hey, good times.
And Drew hasn't had any of this stuff. Like, he's a purist, so.
Well, I think we should get you guys, we should film it. We should do something at my office, and we could,
let's do a botched. We can't really do a botched episode because
I tried to get my stretch marks looked at, but they weren't bad enough for botched. So.
Oh. But maybe you could have the botched on the eyelid thing.
Yeah, my family has droopy eyes. We get kind of droopy eyes, but you know what? I'm not that worried about it, really. Personally, I like being natural, but I don't know. I'm always intrigued by it, and it always makes you feel so good afterwards. You go, wow, why didn't I do this sooner?
Yeah.
I was so worried about it.
And Paul, I want to talk about how you got into this field and what you thought about it and what your sort of journey was getting there. But before we do, is the botch season just finished, right?
Yeah, the botch season now, we just finished our last episode last Thursday. I mean, not a few days ago, I should say, 2 weeks ago.
Yeah.
And then hopefully they'll go back on another 4 or 5 months, or 3-4 months, for another, 8, 9, 10 episodes. That'd be fantastic.
That's when Susan and I are going to be on the episode.
Exactly. There you go.
What about medical tourism? What about people going to other places to get? Somebody asked me the other day about getting just simply veneers for $5,000 versus $20,000. And I'm like, oh.
I have to tell you, there's so much medical tourism. Like when I was in Australia recently, they all were going to Thailand. Now, Thailand, for example, as you know, there's like the famous place for doing the transgender, sexual reassignment surgery. And, you can go, no matter where you go, you can get good cosmetic or veneers.
Yeah.
But at the same point, some places in Mexico, different places that are really inexpensive, you can have a problem. You can get botched.
I don't know how you
watch the show. We see that all the time.
Yeah, a lot of that stuff is from medical tourism or just from other countries. And I just don't know how you protect yourself if you're going to go do that.
You're taking a crapshoot. I mean, the bottom line is, let's say you have 5 friends that went to a doctor in Tijuana.
Yeah.
And maybe they got lucky. They had a good result.
Yeah.
But then you go, and you could have a massive infection because they weren't really sterile.
Right.
And to the point where you can get septic shock, and then it could kill you. Mm-hmm. So there's things that can happen. And so you never know. That's why, obviously you can have bad treatment in the United States. Like, for example, I was in Australia. When I was there, I was doing interviews for Botched and for my skincare line. While I was there, somebody was working in some type of a shopping center clinic for aesthetic procedures, and there I think you don't have to be an RN to do injections.
Yeah.
Some woman who was, I think, I don't know what she was doing. I don't know what her background was, but she injected something into someone's breast, a young lady's breast, and she injected lidocaine with, I think, epinephrine or some type of anesthetic. And the lady ended up having a cardiac arrest on the table, and they did CPR and called emergency services. She died the next day.
Yeah, well.
Young girl, 33 years old.
Yeah.
And so you never know. I mean, this could happen anywhere.
Right.
That's why you got to do your research.
Into a subclavian vein or something.
Yeah.
So talk to me a little bit about, I want to talk to you about some of your toughest cases, but first I want to talk about how you got into this field. And so I met you back in the 80s, right? You and I?
Yeah, that's before
medical school.
You met me before medical school.
Yeah. And when you went, did you know ENT was something you were interested in, or did that just evolve during the years?
No, it evolved. I mean, I had no clue. I mean, when I met you, whole goal was trying to get medical school. I finally got in.
Yeah.
And then, and then when I got into, then I got excited about ear, nose, and throat because of all the anatomy.
Yeah.
And there was a doctor, and you know who he is. The doctor, he passed away now, but Howard House.
Oh, sure.
He was a famous otologist.
Yeah.
I used to watch him when I was in medical school do ear surgery. And then that got me excited. And so I went into ear, nose, and throat. And 20% of that is facial plastic surgery.
Really?
Yeah, 20% of it is, noses and faces and
is it sort of traumatic trauma stuff, right? Is it more that?
I mean, no. Trauma is part of it, but no, facial aesthetic surgery, especially noses.
Wow, did not know that.
With the ear, nose, and throat.
This was at SC?
I was doing this at, medical school was at SC, but I did my residency in Albuquerque, University of New Mexico.
Interesting.
And I actually ended up having a small private practice of facelifts and brow lifts in my last year of residency, a chief resident. And the reason why I got into it, we were doing reconstruction. I was going to go into ear surgery, ear/brain surgery, called neurootology. And then a little boy came in who got attacked by 3 pit bulls. And his face was, shall we say, it was a horrible situation.
Yeah.
And this boy was so sweet and so loving still. He was like 6, 7 years old. And we did multiple surgeries. And luckily, towards the end of it, the reward of watching the improvement, without dealing with someone's, life in your hands in general was so rewarding to me, I switched. And that was my deciding factor.
What do you mean by the life in your hands? What do you mean?
Well, in some of the head and neck, during ear, nose, and throat, you're dealing with a lot of head and neck cancer.
Yeah.
And a lot of these patients, do pass away,
Yeah.
After a short period of time, after surgery.
Right.
Because of the, how bad throat cancer and everything else is.
Right.
And so that turned me off. The neuro-otology I liked a lot, which usually you're dealing with little, hopefully benign tumors, behind the ear, the nerve of the ear, near the brain, and some of the ear surgery. But was exciting.
Do you have to do any neurosurgery to get expertise in that?
No, you have to have a neurosurgeon with you.
Because it's the same instrument, right? You drill into the skull with that same...
You're drilling, we do all that, the mastoid behind the ear.
Yeah.
That's what the ENT guys do. Yeah. We do. But then we need the neurosurgeon to do some of the brain part.
Sheesh.
But then doing that, when I started doing the facial plastics, it was so exciting for me that I just said, I'm doing this instead.
There's some weird divide between people that love surgery and people that don't. As a practitioner, I'm on the don't side. I just don't like being in surgical suites. My back hurts. I'm not that interested in what's going on anatomically. I'm interested, but I'm not enraptured by it the way a lot of guys are, and women. You have any sense of what that difference is? It's just
it's interesting. It has to do with personalities.
Yeah.
I mean, I'm a type A, hands-on kind of guy, and this is almost more like a technician.
Yeah,
I'm not degrading myself saying I'm a technician.
No,
but
no.
in a way,
it's
you are, and it's an aesthetic eye, and I like that. Maybe the right side of the brain a little bit. It's interesting. I do want to make a comment about you since I've known you for almost. Oh my God!
Don't even think about it.
Too long. Like 37 years.
Now you're going to fix my neck and face. It's been long enough.
Jesus.
I know. I remember watching you go up an elevator with a mattress and Drew's sister.
But the interesting thing about you, from the first time I met you,
yeah,
and especially when I used to listen to you with Loveline, and it's funny, as we were talking about you last night about Loveline, and one of the things about you, and I used to hear you talk also about addiction, and from the radio from 35 years ago. You have that knack of your brain that you can actually take something and diagnose different disease processes and really use your brain to figure out what's wrong with somebody, which is a special talent that not many people have.
No, I know exactly what you're talking about. Yeah, it's a weird synthetic thing where things, the pieces fall into place for me, and I can smell it. It's literally like it's an experiential thing. It's weird. I understand what you're talking about. I've not thought about myself that way, but I am aware I do that because I often put stuff together. People go, huh, what? I go, no, that's what that is. I just know it.
And so, but not many people, Drew, have that. I mean, listen, yes, there's a lot of primary care doctors, but you are one of the few that can take that, and so with that, people need that.
Well, and to be fair, I got it from my dad too, and what goes with it is a judgment. My dad had exquisite judgment. He could. I'll never forget this. A friend of his got sick with a fever, and his wife got sick with a fever, and they'd been traveling, and they were traveling up in Montana or something, and he literally looked at him. He looked at him, and he went, he'd never really had maybe seen one case of this in his life, and he went, I think you have Rocky Mountain spotted fever. And I was like, what? Rocky Mountain? Yeah. And he pulled a book off the shelf and opened it up and read the thing. It was, look, this is it turned out. And there was a whole story attached to this where this doctor had pulled the tick off himself and he dropped the tick and it clicked. And, the Dermacentra americanus that causes Rocky Mountain spotted fever is a hard tick. And they put the tick in a container. It turned out to be one of them. It was a crazy story. So I've always said in all of that kind of thinking, and then the judgment that goes along with it. He made calls on himself before he died that were like, I was like, why are you doing that? He's like, I think it's the right thing to do. I go, I don't know, and right thing to do. So the judgment is another interesting thing.
But just even what you just did today, you talked about Rocky, mountain spotted fever, and then you just diagnosed the disease process. What was it? The tick with that, whatever word you just used a minute ago. Who remembers things like that? These esoteric facts like that.
Yeah,
you do.
Yeah. Well, that's how my brain. We have one of our son has that too with the detail and memory and stuff, which is weird too. But and the other reason I remember too, I'm developing a television show around this idea, is that I was traumatized during medical school and residency. I was constantly in a state of trauma, and it was sort of my own personal psychology that made me want to do good for the residents and the attendings and stuff. But it was so traumatic for me, and being over my skis all the time, that I remember everything. That trauma was good. It was not a bad trauma. It was a good trauma. I don't know if you ever experienced that as a surgeon, where you're sort of. Did they train you ever when you were sort of over your skis when you're as a resident?
I don't know if I've had that type of a traumatic, experience like you did on that.
Yeah. Well, I think that's unique to medicine. They kind of do that to you. They just beat the crap out of you, and you're not really doing anything dangerous. You're just over your skis. You feel like you're over your skis all the time.
Well, wait a minute. You know what? Wait a minute. You're right. I think for me, you're right. That was at USC, or if I'm not mistaken, my third year of medical school.
Oh, yeah. Oh, yeah.
Oh, there you go. You know what? There you go. That was it right there.
Oh, yeah. That's where it started for me. That was where it was most intense. That was the most intense for me, and then it just stayed. It just kind of stayed. Fourth year, it let down a little bit, and then it stayed again. So that's interesting to me.
You're right. There you go. I just empathize with that 100%.
And okay. Talk to me about the most difficult cases you've seen.
The interesting thing on Botched, we've just aired season 4. I mean, every year the cases keep getting harder and harder. And, one thing that Terry and I, it's happened to us, is our experiential of how to deal with the problem now has increased about 1,000%.
Well, this is
back
to
any type of procedure.
This is back to the kind of learning and thinking you were just talking about. Now you guys do it in a surgical context, which I could not do because it requires a spatial thinking, spatial problem solving. I got none of that. Right? Are we talking about the same thing?
Yeah, you're 100% correct.
Yeah.
I mean, because this has now taken us to a different level, and the cases we're seeing now is, I had a patient who had 15 nasal surgeries, for example.
Ugh.
Her nose and her skin was completely destroyed.
Oh.
And I warned her there's about a good 40% chance that she could have a problem with her skin tissue, that it would necrose after.
Now, where'd you come up with that number? It's not 50-50, but 60-40.
It was because after doing so many noses and looking at her tissue, I just picked that number. Maybe it was 30 or 50. Who knows?
It felt right. That's the judgment part I'm talking about. That's that judgment piece that has to be developed experientially. Good.
And you know what's interesting? Right after surgery, after I did a reconstruction on her nose, she started having the complication, but not as severe as I thought. And we show on the show how we deal with actually, the blood supply to the tip of the nose and the skin dying. I mean, so the cases are just getting harder and harder in regards to, technically, I have to tell you, it's gotten easier for both of us to do the hardest cases in the world.
So did you do the what's the name of the show? The NICS, the NIC procedure where you had to sew somebody's forearm up to their tip of their nose.
Yeah, to their head. Oh my God! No, you're right. That's right. Like a forehead flap or the nasolabial flap. No, luckily we did a lot of treatment. Using leeches and nitroglycerin paste and everything else, hyperbaric oxygen, and she healed pretty well. And her new nose was, it was absolutely amazing in regards to the satisfaction that she received and I received. And the other thing is these patients that come in with their nose collapse, where we have to use tissue from the forehead or from the smile lines to reconstruct it. These cases are extremely difficult, but it's the stories too. But the best story, just so I can summarize this, just out of maybe difficulty, but out of a wonderful outcome, was this woman named Lucy DiPrima, who was, I think, on season 3 or maybe 2. And she had a little bit of a leak out of her nose, and she was coming in for a reconstruction. And she got into a traumatic accident, hit a wall when she was driving a moped in Italy. And she had it reconstructed in Boston. But, the result, she was still very insecure. She wouldn't leave her house much. And the horrible thing about that is she has a daughter with autism. So her daughter wasn't really getting her full mother.
So she had like an ethmoid plate fracture or something?
Yeah, she had a complete pan-facial fracture almost. So everything was broken around her.
Like a Laford fracture?
Yeah, everything.
Ugh.
But at the end, her face looked okay, but it was her nose that was destroyed.
Oh.
And when she saw me, she had a little bit of a leak. And so, of course, I'm thinking, brain fluid leaking out of her nose. So I got a CT scan. And it came back, she had 3 aneurysms in her brain.
Oh, boy. 3.
And obviously, one of those aneurysms is big enough that, a little extra Valsalva, a little push, a little high blood pressure in surgery, something,
Wow.
it pops and there she goes.
Yeah.
And so she ended up having it treated. We sent her to a great doctor at Harvard since she lives back east.
Did you have
She had it treated.
She coils done, or what do they do?
I think they actually, I don't know if they coiled it or, they did something, through the vessel, obviously. Yeah. And whatever they did, I can't recall, but they fixed all 3 in 2 different sessions. And then she came back and we did her nose.
Were these?
She's out with her daughter, and that was cool.
It. Were the aneurysms related to the trauma, or were they berry aneurysms that were just genetically there?
I think genetically. It wasn't related to the trauma.
Huh. Fascinating. Oof.
I had a cousin in Boston, too. It's really interesting, but not in the same area of Boston, but, he woke up one night and he, had an aneurysm burst in the middle of the night and he died.
Oh, my God.
And he was about, 21 years old.
Ugh. Awful. And tell me about this elephant trunk surgery that this woman refused.
You mean the forehead flap?
I don't know. Is what were you talking about there, Michelle? Where they take part of the forehead. Oh, this is the forehead flap. Oh, yeah.
Yeah.
That's what they call it.
It's called an elephant trunk surgery?
I don't know that.
Yeah, and I think this is one of the patients that had the 15 surgeries and she needed a forehead flap.
Yeah.
And she just didn't want it. She goes, no, and that's what she really needed. But we ended up doing some reconstruction, and luckily, her, better lucky than good, her result came out fantastic without using the flap. And I told her, though, that me operating on her face, that there was a chance that, the tissue could completely just die. And if it does die, you are going to need the forehead flap no matter what.
So she's
but luckily,
take the risk.
She did pretty well. She just said, I don't want to walk around with that big thing attached from my forehead down my nose, which looks like an elephant trunk, for, 6 weeks.
I see. Is there anything that you'd like to do coming up, or you'd like to show on Botched? Are there things that you're sort of challenges or examples of things you'd like to, make public or understand, get the public to understand?
Since we're fixing botched procedures for me of the face, I've done, the scars and the vascular abnormalities in the noses and a little bit of the face and the chins, just out of a exciting part for me.
You want to do Susan Pinsky? Is that what you're saying?
Exactly. I want to do Susan Pinsky. I want to do a nice facelift on the show.
Okay.
I just want to show a nice neck lift and a nice,
Oh, me
brow.
I get put in there too. No,
and I want a nice little brow lift, and I'm going to do some nice aesthetics to show. Look how good I am. That's what I want to do.
I would love that.
All right, we're on it. We're in. Sign us up.
But I have a question. Can I ask a question?
Please.
So, the whole Michael Jackson syndrome, when you're working in this field, do you deal with a lot of people who are actually not only addicted to plastic surgery, but also to
the opiates?
Yeah,
the part I've noticed that the plastic surgeons were missing back in the day was that these guys were doing this. One of the motivations was, there's body dysmorphia is actually a facial phenomenon originally described. So there's some sort of body dysmorphic process. And opiate addiction. It's a way of justifying taking opiates. And I've treated a number of these people. And last time I thought about this, the plastic surgeons weren't really aware of that. Are they now?
I think most are. Especially with, obviously, body dysmorphic disorder. That's something like Terry and I are kings of, diagnosing that. But I have to tell you, at least from what I do, I have not had any experience, zero experience, in regards to the opioid aspect, because from facial surgery, it's not that painful. They get about a week, and that's it.
Wow.
I'm done.
Wow, you've just sold us on our procedures, by the way.
so that's it, 1 week. And if I go take a little bit of a little bit of Tylenol, don't overdo it so you don't hurt your liver, and that's it. That's it for me.
That's actually that's really surprising to me. These are some big surgeries. When you look at what you're doing, they're not. It's amazing.
It doesn't, listen, it's rare that I do something that causes a lot of pain, that we might have to extend. Well, let me give you 15 more pills for the second week.
Yeah.
And then that's it. Yeah. So I'm really listen, I'm going to take care of them, but I do not overdo it. I give them a little bit of Xanax and a little bit of some pain medicine, and that's it. And then it's done.
Tell me about your skincare products. I'm excited about this for you.
Well, I spent 6-7 years formulating, and I finally Home Shopping Network about a year and a half ago. I think I'm going there in 2 weeks. And I just launched in Australia at the Shopping Channel. And I have to tell you, it's something that I picked a line of products, all specifically for most types of faces, that, really is based on two things. One, hydration with hyaluronic acids of some sort or another, like with microspheres, which really get in there, a good delivery system. Because hydration is what you need for all your tissue. Not moisturizing, hydration. Filling up the skin, with water or your saline. And then the other one is what good active ingredients. And probably my two biggest things that I love in my products is a very stable form of retinol, natural form of vitamin D. And actually, the other aspect of that is vitamin C, a great, antioxidant. And that's what helps brighten up the face. And these two take care of a lot of the wrinkles. And, I have forehead, I have eyes, I have under eyes, I have AM and PM. I have, these detox pads, which, are great with acne and taking off even makeup at night, in case you want to wash your face. So the line is something, I put a lot of TLC in it. Besides selling it, in my office or on my website, nassifmdskincare.com, I do these, I travel and I actually sell it. I'm the doctor on TV selling it, and it's something that I never thought I'd be actually going to Home Shopping Network and doing this or anywhere else, but I have to say I enjoy it because I love my products.
I love your products.
Yeah, Susan uses them like crazy.
I used them all
you've
up.
been using them for a while.
I used them all up.
Well, then you better let me know what you want, and I'll get you some more.
No, I'll buy it. You don't have to give it to me. It's okay.
She wants to be a customer on all your fronts. All right. Well, Paul, thank you so much for joining. I really appreciate it. I know we had some technical problems getting things off the ground today, so I appreciate you being flexible. And you can go back to your workout. I think that's what you were doing when we interrupted.
I started my workout. I made the trainer wait, and I'm going to go start right back.
And watch the new season of Botched. We actually have Tawny Katane coming on today. We're on Facebook Live right now, by the way.
Yeah.
I didn't tell you, Paul, but
hi everybody. Facebook Live.
She's coming on to talk about her experience on Botched and her the removal of her silicone implants, and
she's going on a campaign to discourage the young girls from getting the breast implants. And
you know what? It's interesting. I know we're got to go, but I'll make it quick. I'm with a friend of mine from Arizona who had an explantation herself a year ago from implants, and she was sick for about 2 years.
With the explant or the implant?
No, the prior with the implant. And apparently, there's a whole group of women, and there's over 20,000 strong, that are part of this organization. And I just want to get you the name of the organization. It's Breast Implant Illness.
Healing by Nicole.
Healing by Nicole. Yeah. So it's a whole group of at least 20,000 women that are apparently have had this problem.
Wait, breastimplantillness.com? Is that what we're talking about?
No, Healing by Nicole.
Okay.
Healing by Nicole, is that the website?
.com?
Is that the website, Healing by Nicole?
Yes.
Okay.
And it's also a Facebook page.
What is that?
And a Facebook page.
Breast Implant Illness, Healing by Nicole.
Okay.
Oh, it's one word? It's one thing? Breast Implant Illness, Healing by Nicole.
Got it.
And it's a Facebook also? Yeah, so
Be a woman to go on that.
you have to be a woman to go on there.
So I think Tawny had some problems afterwards because I was trying to book for another podcast, and she actually had some edema, and she was having some lymphatic problems.
She has seroma or something.
Yeah, and she was really sick for a couple of weeks and kind of freaking out.
It's not sick; it's bothersome. That's all.
Well, but and that can happen. When you have a post-op and you have something removed that's been foreign, it could cause some taking it out.
Well, we're going to talk to her about it today.
Yeah, I'll talk to her about it.
I want you to talk to her about it.
I will, but the point being, I lost my train of thought.
Sorry.
Thank you, Susan.
That's what I'm here for.
The point being that there's some. To me, I never bought the whole lupus scenario because it's not what that was. But it does make sense to me that having a foreign body can stimulate your immune system or make you feel not right in a myriad of ways, right? I mean, that sort of makes sense to me.
Well, yeah. I mean, for example, this young lady friend of mine, I'm not going to mention her name right now, but she's actually pretty much well known, and you probably even know who she is. And maybe we'll talk offline in case you need to talk to her at some point. She's been on the doctors talking about it and everything else like that. And she actually, I think, did develop a positive antibody after it.
Oh, really?
And I think,
but still, a positive antibody is not a lupus diagnosis. You know
you're
what
right,
I mean?
you're right. No,
and
it's
to me,
not
it's just
lupus
like
at all.
it's like the immune system. It doesn't diminish what they're experiencing, but it made it just put it in a category where it lost itself. You know what I mean? It became now a legal battle around lupus and things. It's like no, I think that's not it. But there's something going on for sure.
Yeah, I mean, it's interesting. And by the way, because she's here visiting from Arizona, and obviously you could always edit this out. Even though, we're Facebook Live.
Yeah, I wouldn't.
Do you want me to?
Drew,
she said it's okay
Drew's already
because it's out
guessed.
there.
He's already guessed.
Don't, it's all right. We're on Facebook and stuff. Don't tell that to
You
her.
can text it to me afterwards.
Okay, because I just talked to her. She's fine herself, but I could, because she said it's out there already. It's in the public.
Well, whatever you want, whatever she would like, you can do.
I mean, so you want me to say? I mean, she's okay with saying it. So is that okay?
Yeah, go ahead.
Yeah. Her name is Karen McDougal.
Okay.
And so that, she went through the whole summer, so it's interesting about this whole breast implant, whether it's an illness or whatever, Tawny had, the reason why she wanted them out, which, I forgot the actual mechanism of why she wanted them to remove them.
Yeah, we're going to wait for Dr.
She didn't like the cosmetic. It was uncomfortable. She'd had 4 different revisions, and it was just
She's really happy now.
She had like an awakening about it. Like, what am I doing to myself? Yeah, it was sort of
Well,
that
there
kind
you
of
go.
thing.
She showed me her
Different
boobs
reason,
today.
Yeah. She showed you your boobs today?
Yeah. Do you want to see them?
That's okay. I'm good.
You're going to see them later. All right. Well, listen, you guys have a great day. Tell her I said hi. Give her my regards.
They look good, though. She
By
looks
all means,
great.
Paul, thank you so much for joining us, man. Get back to your workout and do take care, and we'll see you under the knife.
Your
soon
show
enough.
is amazing.
That's right.
Your
Get ready,
show
my
is
friend.
amazing. Producer Michelle is a huge fan.
Give me your website one more time, Paul, before we go.
My regular website that's the more important one is drpaulnassif.com.
Yeah. All right. And
Love you guys.
For everyone else, we'll see you soon. All right, it is fall and your immune system is about to get tested, everybody. Not only does the changing weather mark the start of cold and flu season, it's also back to school time when kids become walking petri dishes. While catching something may be inevitable, there is no excuse for letting yourself get dehydrated in the process. So when you're wiped out with cold or flu, the first piece of advice, always to drink plenty of fluids, but we seem to forget that. Now, once you've started feeling dehydrated, it's already too late for water or sports drinks. Rapid rehydration requires the proper balance of sodium, glucose, and water, and nothing gives this like Hydrolyte. Hydrolyte's formulation is based on established, proven science, and it is the simply best rehydration product I've found in this country. Hydrolyte comes in great flavors, orange, berry, lemonade, and it's available in a pre-mixed drink, a powder, or what I prefer, those effervescence tablets. You just drop in a glass of water or a bottle of water. Off you go. It's like your own portable IV, but you can do it enterally. Compared to sports drinks, Hydrolyte delivers up to 4 times the electrolytes with 75% less sugar. Hydrolyte solutions are appropriate for all ages, and each bottle or package includes easy-to-use, easy-to-follow instructions. You can find Hydrolyte at Rite Aid or online at Amazon.com. And for a limited time, our listeners can save 30% on Hydrolyte. Just click the banner on our site, drdrew.com, and use the code DRDREWHY, DRDREWHY at checkout. That is DRDREWHY.
Remember, you can find all these podcasts at drdrew.com. The Dr. Drew podcast, the This Life podcast with Dr. Drew and Bob Forrest, and the Adam and Drew podcast, which is available 5 days a week. Find them all on iTunes and rate us 5 stars. Subscribe and get it first. And if you're really happy, click on the Amazon banner at drdrew.com to help support the show. We'll thank you for it. If you join the email list via drdrew.com/contact, we'll send you a weekly infusion newsletter with Dr. Drew's news. We're so grateful when you get in touch. We read all your emails and we'll bring you the subject matter you want to hear about.